Welcome to Let's Talk Tillamook, where we take a closer look at the changes shaping our lives here on the Oregon coast. I'm your host, Shayna Peterson. Today we're focusing on Medicaid, what it means for access to care, and how upcoming changes could affect families and neighbors in our community. To help us sort through it, I'm joined by Dr. Tim Borman, who spent years caring for this community. Dr. Borman, please start by telling us what Medicaid is.
Medicaid is a joint federal and state program that helps cover medical costs for people with limited income. The federal government has general rules that all state Medicaid programs must follow, but each state runs its own program with rules specific to the state. In Oregon, Medicaid is called the Oregon Health Plan, or OHP. The people who receive Oregon Health Plan benefits include eligible children, pregnant women, people with disabilities, and elderly adults. In Oregon, the federal government pays for about 76% of the cost of the Oregon Health Plan, while the state of Oregon pays about 24% of the cost.
What's the difference between Medicaid and Medicare?
Great question. The Federal Medicare and Medicaid Act was signed into law in 1965. Medicare is a federal health insurance for people 65 years or older, and some people under 65 with certain disabilities or conditions. Because it's a federal program, Medicare, as compared to Medicaid, has set standards for costs and coverage. This means a person's Medicare coverage will be the same no matter what state they live in. Although the federal government pays the majority of the cost of Medicare benefits, people who receive Medicare benefits pay part of the costs through monthly premiums for supplemental medical and drug coverage, deductibles, and co-insurance. Long-term care in a nursing home is not generally covered by Medicare, but if someone cannot afford the cost of nursing home care, the Oregon Health Plan may pay for long-term nursing home services. Currently, the Oregon Health Plan pays for nursing home services for approximately 60% of nursing home residents in the state of Oregon.
How many people does the Oregon Health Plan serve in Oregon and Tillamook County?
Currently, 59% of children and 34% of adults in Oregon are covered by the Oregon Health Plan. Nearly half of all births in the state are paid for through this program. Additionally, 3 out of 5 nursing home residents rely on the Oregon Health Plan to cover their care. Approximately 8,000 to 8,500, or 30 to 32% of the population of the people in Tillamook County are enrolled in the Oregon Health Plan.
Who's eligible for OHP? Can anyone sign up?
Not everyone qualifies for the Oregon Health Plan benefits. The Oregon Health Plan serves individuals and families with limited financial resources. Eligibility is based on income, family size, health conditions, and other factors. For example, for a 4-person household to qualify for Oregon Health Plan enrollment, the family's yearly income must be less than $43,000.
Dr. Borman, how will the budget and spending bill passed in July of this year impact people who rely on the Oregon Health Plan for health care?
Beginning in January of 2027, states including Oregon will be receiving less funding for Medicaid services from the federal government, resulting in less funding for the Oregon Health Plan. This cut in funding will lead to a reduction of health services for patients enrolled in the Oregon Health Plan, and also fewer people will be eligible for enrollment in the Oregon Health Plan.
So, if the Oregon Health Plan is facing big reductions, what does that mean for rural communities like Tillamook?
Without insurance, more people may delay seeking health care services until their health condition worsens and/or forego regular screenings and preventative care, which can lead to more complex and more expensive health care services and worse health care outcomes. In other words, a neglected, relatively simple health care problem may become a complex medical problem requiring admission to the hospital and, in some cases, prolonged illness, permanent illness, and even loss of life. For example, delaying treatment for diabetes can have very serious health impacts. Without health insurance through the Oregon Health Plan, people will use the emergency room for health care, which is a much more expensive option than getting treated at urgent care. The average urgent care visit for a person without health insurance costs anywhere from $150 to $250, while a visit to the emergency room for the same condition is $1,500 to $3,000. A reduction in funds may lead to financial collapse of smaller community hospitals. Loss of available community hospitals will negatively impact all community members and will require increased travel times to larger city medical centers for anyone seeking hospital care treatment. Rural Oregon hospitals are considered financially at risk. Eric Swanson, Adventist Tillamook president, has indicated that 35% of its patients rely on the Oregon Health Plan. At this point, he cannot forecast the specific impact of federal cuts in Medicaid, but he says it's going to be devastating to people on Medicaid.
Dr. Borman, we understand that there'll soon be a work requirement to qualify for Medicaid. What can you tell us about that?
Currently, 71% of Oregonians enrolled in the Oregon Health Plan are employed. Most of those who are not working are people with disabilities, people with certain health conditions, and the elderly. In 2027, most Oregon Health Plan recipients aged 19 to 64 will be required to document each month that they have worked at least 80 hours or confirm that they are exempt from the work requirement. The details about how this would be implemented in Oregon and the cost of administration are not clear at present, but documentation of work hours will be online, which may be a hardship for some people.
Dr. Borman, what can people do now to address these Medicaid changes?
If you believe you may be eligible for the Oregon Health Plan, I encourage you to sign up now. It will become more difficult, time-consuming, and challenging to enroll in the Oregon Health Plan after December 2026. Go to oregon.gov/OHP. Nearly all questions about Medicare or Oregon Health Plan Medicaid can be answered at this website. Also, the Tillamook Community Health Center can be a great resource for determining if you are eligible for the Oregon Health Plan and is available to assist completing an application for enrollment in the Oregon Health Plan. As so many Oregonians receive Oregon Health Plan benefits, please share this information with your friends, family, neighbors, and coworkers. If you have a story to tell about your experience with the Oregon Health Plan, please consider writing a letter to the editor.
That's all for today's Let's Talk Tillamook. My thanks to Dr. Borman for joining us and to you for listening. These conversations are about understanding how changes in policy affect us right here at home. Be sure to watch for the next episode. It'll be available soon. And you'll also be able to find Let's Talk Tillamook on YouTube, so you can listen anytime. I'm Shana Peterson. Thanks for tuning in, and let's keep talking.